Welcome to Solano Community College's Disability Services Program, Jumpstart. What is the Disability Services Program, known as DSP? We provide information and services to Solano students with a documented disability. We empower students, we foster independence and self-advocacy, we promote achievement of realistic career and educational goals, and we assist students in discovering, developing, and demonstrating their full potential and abilities. We work with students, faculty, and campus staff to determine and provide reasonable accommodations and services to students with disabilities to ensure equal access to all Solano College programs, services, and activities. The first step to qualify for DSP is to provide documentation outlining the nature of disability. Documentation must demonstrate a disability covered under Section 504 of the Rehabilitation Act of 1973, the Americans with Disabilities Act, ADA, of 1990, and the ADA Amendments Act of 2008. The ADA defines a disability as a physical or mental impairment that substantially limits one or more major life activities. Additionally, the documentation must show functional limitations that impact the student in an academic setting. Documentation must come from an appropriate and qualified medical professional, and it should provide his or her name, title, and professional credentials. Documentation should also include a diagnosis indicated by ICD-10 or DSM-4 codes, the provider's signature, and the date signed. Other acceptable documentation would include psychological evaluations, Department of Rehabilitation Significance of Disability form, an individual educational plan, IEP, neuropsychological test results, etc. Please note, documentation such as an IEP or a history of receiving accommodations from a former school does not necessarily validate the need for services or continuation of accommodations at the university level. If you are planning to transfer to a UC or CSU, please check with your preferred schools to find out what type of verification of disability is required there. Recommendations and rationale for receiving accommodations must be based on the analysis of the functional impact of the diagnosis. Services, accommodations, and/or assistive technology will be determined on an individual basis upon documentation review and consultation with your disability counselor. Students may receive temporary accommodations for one semester even if they do not have documentation, but must plan to get verification for upcoming semesters or services will be discontinued. Each semester, students who plan to use their approved accommodations will need to request an accommodation letter from the DSP office. It is your responsibility to talk with your professors so they understand the significance of these letters and are aware of the protocols they should follow to ensure timely delivery of services. If you need to request a modification of your accommodations, you should meet with your DSP counselor to discuss changes. Post-secondary schools do not have to provide personal services relating to certain individual academic activities. Personal attendance and individually prescribed devices are the responsibility of the student who has a disability and not of the institution. Categories and documentation guidelines. One category is blind, visually impaired. This includes limited visual acuity, constricted peripheral field, and/or progressive vision loss, including those that are legally blind. Individuals with visual disabilities are so varied that some may need enlarged texts, while others may use a service animal to navigate campus. Deaf, hard of hearing category. Hearing loss may range from moderate, requiring the use of a hearing aid, to severe, profound, that may require information to be presented visually through American Sign Language or captioning services. All conditions and interventions vary by individual, so it is important to identify which means of communication works best on a case-by-case basis. Physical mobility disabilities category. Conditions that may be congenital or the result of accident or illness, such as spinal cord injury, paralysis, cerebral palsy, spina bifida, stroke, and muscular dystrophy. These conditions cause pain, spasticity, and/or lack of coordination and are often episodic in nature, causing intermittent flare-ups of symptoms and periods of remission. Medical disabilities category. Chronic health conditions such as cystic fibrosis, diabetes, multiple sclerosis, cancer, AIDS, hemophilia, epilepsy, and hepatitis that can affect cognitive and motor functions. These conditions may cause fatigue or even have acute phases that require bed rest or hospitalizations. Traumatic brain injury category affects brain functioning to varying degrees in the area of memory, communication, processing speed, spatial reasoning, executive functioning, psychosocial behaviors, or motor sensory and physical abilities. Psychological disabilities category. Conditions that impact how a person feels, acts, thinks, or perceives the world around them, such as depression, bipolar disorder, generalized anxiety, obsessive compulsive disorder, PTSD, schizophrenia, and eating disorders. Learning disabilities category. Disorders that create deficits in receiving, processing, integrating, and/or expressing information specific to communication, reading, writing, spelling, calculations, or coordination. Attention deficit disorders, ADD or ADHD, neurologically based condition that causes distractibility, hyperactivity, or both. ADHD can cause particular difficulties in the academic setting due to increased demands on focus, concentration, and organization. Autism spectrum disorder category. Continuum of symptoms that display impairment in thinking, feeling, language, and the ability to relate to others. This can cause challenges specifically in group work, meeting with professors, and engaging in social functions on campus. Temporary disabilities. Academic adjustments may be recommended for students with temporary injuries such as broken bones or recovery from surgery. Please join us for the next video on the forms that must be filled in and another video on frequently asked questions.